Upon your arrival at the hospital, the nurse specialist examines you and consults with the radiologists, the gastroenterologist, and the general surgeon. Your medication is reviewed by the pharmacist and your meals by the clinical nutritionist. Throughout the hospitalization, you are followed by a hospitalist. Once you get back home, the home care team comes to see you regularly for the first 2 weeks, and the certified physician assistant and the doctor of nursing practice, or DNP, see you in the office. You realize that healthcare is no longer just about doctors and nurses. You ask yourself, what roles do all of these health professionals play in the healthcare system? Sarah was about to begin medical school and was expecting 2 years of preclinical classroom lectures focusing on the basic sciences, followed by the study of clinical diseases. Then, as she had heard from her physician father, she expected 2 years of clinical hospital rotations and electives, investigating specialties. She is surprised to find that medical school has changed. There are small group, problem-based learning sessions where she needs to be able to locate and read the research literature. There is contact with patients and their problems right from the beginning. There is increasingly a 4-year approach instead of a preclinical and clinical approach to medical education. She wonders, are recent changes in medical training for the better? What else needs to be done to improve medical education? Until the early years of the 1900s, education and practice for the health professions in the United States were an informal process, often without standardized admission requirements, curricula, or even formal recognition of a profession. Throughout the 1900s and into the 2000s, there has been an ongoing movement to formalize and standardize the education process for health professionals. These formal requirements have come to define what we mean by a health professional and include admission prerequisites, coursework requirements, examinations of competency, official recognition of educational achievements, and granting of permission to practice. Today, the list of formal health professions is very long. Clinical health professions include physicians, nurses, dentists, pharmacists, optometrists, psychologists, podiatrists, and chiropractors. They also include nurse practitioners, physician's assistants, health services administrators, and allied health practitioners. Allied health practitioner is a broad category in its own right, ranging from graduate degree, trained professionals such as physical therapists, occupational therapists, and medical social workers, to technical specialists, often with an associate's degree, such as dental assistants, sonographers, and laboratory technicians. Defining and enforcing educational requirements is central to creating and maintaining a profession. This can be accomplished using 2 basic approaches: accreditation and credentialing.